Coming up on Carnegie-Knight News, a special report looking at the impact of the landmark decision to overturn Roe v. Wade.
We explore how restrictions on abortions in some states are pushing patients to seek care in other states.
And how doctors and patients say the law is affecting their health care.
Good evening and welcome to Carnegie-Knight News on Arizona PBS. I'm Shelby Ray Wills.
And I'm Deanna Pistono. Thank you for joining us. Tonight we bring you part one of a two-night special exploring the impact of the U.S. Supreme Court's decision to overturn Roe v. Wade, which eliminated the federal right to abortion and returned regulation to the states.
This report features work from America After Roe, an examination of the impact of the reversal of Roe v. Wade on healthcare, culture, policy, and people, produced by Carnegie-Knight News21.
We were part of the News21 team. As a team of 25 journalists from universities across the United States, we spent the summer traveling to cities big and small with a goal of helping the public better understand the impact of this monumental decision.
First up tonight, as more states pass abortion bans, providers and patients are flocking to other states where abortion is legal. New Mexico has become a sanctuary for abortion rights. As filmmaker Mingson Lau shows us, the anti-abortion movement has followed.
Logan Brown.
Ladies and gentlemen of Hobbs, New Mexico, the issue of abortion is a black and white issue. There is no gray.
We gained a lot of ground with the overturning of Roe v. Wade, but now it's at the state level, so now it's instead of one battlefield, it's 50 battlefields. And so, end of June last summer, Roe was overturned, and immediately, obviously, there was one abortion provider called Whole Women's Health. They're like, well, we're shutting down and we're moving to New Mexico. And so we knew we were a border town, so we knew we were going to be a hot commodity for them to move. What are we going to do with no money, no resources? And that's when we ran across Mark Lee Dixon and the Sanctuary City for the Unborn Initiative out of Texas.
We go where there's interest. We don't reach out to cities. We let people in cities reach out to us. So in a nutshell, the Sanctuary City for the Unborn Initiative came to be because there was an abortion facility at one time that was looking at crossing the border from Shreveport, Louisiana to Wascom, Texas. That community didn't want an abortion facility in their city. And so we ended up presenting an ordinance there in Wascom, Texas. That resulted in the city of Wascom becoming the first city in the nation to pass an ordinance outlawing abortion within their city limits. Many other cities followed in their footsteps.
Hobbs has been targeted by Whole Women's Health. And the majority of the lives that will be ended here if they open up are actually Texas babies. It's Texas residents who are going to be coming here for abortions.
My name's Reverend Erica Ferguson, and I work in the reproductive health rights and justice movement. And, well, fast forward, after many years of working in this movement, I find myself here in Texas running what is called a travel program. And that travel program helps get women to their medical needed procedure outside the state of Texas where it is illegal. The first group I took was a group of 25. We got on a plane, we flew to New Mexico. All 25 of them were able to get their procedure that day, and then we flew back. I don't know if people really understand the impact of what women have to go through in order to get what they need. Their divine, human, basic right to medical care.
And we're just a group of concerned citizens and Christians, and didn't want these clinics opening up in our towns. Because before, it was always Santa Fe's problem or Albuquerque's problem. And yeah, we don't like it, but it's over there. And it's kind of that separation in our head of that's happening over there, it doesn't affect us. Well, now it's affecting us.
Once Roe fell, I think it took a little too long for me to get to that realization that nobody's going to come to save us, you got to do it yourself. Before we started, none of us knew. We all felt so isolated, like we were just like a little dot in this red sea of people.
They had an organized plan to target some more red, conservative-leaning counties in blue states, to use them as a testing ground to see if they could get these sanctuary city ordinances passed, either at the city levels or at the county levels. They were marketing it as, we need these ordinances to prevent women's clinics from opening up in the counties that are close along the border of Texas.
When you look at the language in the ordinances, they are very stupid, they're very controlling, they are very out of touch. It's somebody else with money and another agenda coming in. And the fact that it was written and pushed by people who don't even live here. They need to stay where the heck they are. They're just coming in here, riling up the most extreme people and pressuring our local government by screaming at them.
We lobbied with the state legislature to help support getting legislation like HB 7 passed. That's the New Mexico legislation that guarantees the gender-affirming care and also completely nullifies the sanctuary city ordinances and makes them just null and void.
There's more Democratic influence right through the heart of the state, but in the eastern part of the state, it's much more Republican. And then you've got, proximity to Texas. So yeah, there's polarization, but I think it's seeping into state and perhaps even local politics more and more. We've got rural Democrats that lean in a more conservative direction, and so they might not always stick with that party affiliation as a guide to voting. It's not as straightforward as it might be in a place like California or New York or Illinois that are more heavily ideologically liberal.
I'm afraid that we as a nation and as a world, we're going to look back on this time of legalized child sacrifice, and we're going to say, how did we get to this point? It's the social issue of our time, and whatever side of the aisle you're on this, you see it playing out. Like every election for the past 50, 60, 70 years has been won or lost in some part to this issue.
Many abortions are performed because of medical emergencies in cases of wanted pregnancies. Since the reversal of Roe v. Wade, many doctors have found it increasingly difficult to provide care for their patients.
As filmmaker Joseph Qual-Zachariah tells us, many healthcare providers around the country have decided to take on roles of outspoken advocacy.
I was finishing college when Roe passed, and my college years were also some of the time of protests against the war in Vietnam. And so many students were engaged in some of that political activity, and we felt like we made a difference. And then civil rights, and we felt like we made a difference. That things were moving in a positive direction. And then to see this just complete U-turn, I think many of us are still in shock.
It was a Friday, and I was going to a concert with my daughter. And I was anticipating it. I decided to go to the concert. And, my daughter and I sat through the concert and cried. And I was glad I was with her because she's a young adult, and it's a different generation worrying over this.
I was actually in Europe on vacation when that decision came down. It was just a very devastating day. First there was a lot of anger at how they could do this, and then it's kind of like, okay, well, what does this mean? Am I still going to be able to care for my patients? Am I going to go to jail for providing basic care that people need? So there was a lot of fear along with that.
Within hours, we were under a 6-week ban, and it was a weekend. And I was at work, and so I work as an OBGYN hospitalist. I run the triage or OB-ED, so the ER for pregnant ladies. And I thought, well, what's going to happen if something comes in tonight? There's a criminal penalty here, which would mean that not only was I at risk for losing my medical license, and so not having a job, I was at risk for going to jail, having a felony charge, and I just didn't know what that would mean because I was providing evidence-based health care. And what was I going to do if someone came in and I had to make that decision?
And one thing I realized, I guess, just really sitting in that concert, was that I thought this fight was over. I thought it was done. We had done the hard work. My generation had gone forward and, held the banner and made it safe and reasonable for the women to come after us.
Now I have to think about consequences that I didn't have to think about before. My patients have to think about consequences. I've had patients in a roundabout way let me know that they intentionally did not make me aware of some of the decisions they've had to make post these legal changes because they didn't want to put me under fire or under criticism or bring scrutiny to me as a provider that they appreciate and value. And that's not how this is supposed to be.
I truly had a moment where I felt like somebody had taken my hands and had tied them behind my back. And I felt like, this isn't medicine the way I was trained to practice. This isn't ethical. I don't want to do this anymore.
One big change, though, that I have seen since Senate Bill 8 passed is we do see a much larger amount of patients that come in requesting permanent sterilization. Since Senate Bill 8, patients that are more fearful of dealing with an unwanted pregnancy.
They are frightened just to conceive intentionally because they worry that they would have a complicated pregnancy situation, and what would they do? These are healthy, reasonable people that are scared to have a baby, the most basic of all human instincts.
I have a number of colleagues who are specialists in family planning. Some work at Planned Parenthood, these are physicians, and I had said to them many times, if there's ever anything that you feel like you can't say publicly because you are younger than I am, you have young children, you have families you want to protect, all of that, let me know. When this lawsuit came up, I know some of them mentioned my name to the attorneys, and the attorneys contacted me, and I said, here's my chance to finally live up to my offer. And that was how I got involved.
It is now dangerous to be pregnant in Texas. We filed this lawsuit last night to stop the unnecessary pain, suffering, injury, and life-threatening complications caused by Texas's abortion ban.
Our first witness will be Ms. Zarowski.
Chairman Durbin, Ranking Member Graham, and members of the Senate Committee on the Judiciary, thank you for the opportunity to testify before you today. My name is Amanda Zarowski, and I'm here to tell you a little bit about my experience with the Texas abortion bans. About 8 months ago, I was thrilled to be cruising through the second trimester of my first pregnancy. I was carrying our daughter Willow, who had finally, blissfully been conceived after 18 months of grueling fertility treatment.
We were in disbelief because even our specialist didn't think it was going to work. We didn't really think it was going to work. So we were just like shocked and over the moon excited because we just weren't expecting it. I took 3 pregnancy tests though because I didn't believe it at first. I couldn't wrap my head around it. It was just the best.
Yeah, I mean, I think there was definitely, you feel excited and then it's like, oh, this is about to happen, and you have to kind of change your mindset on how you think about life when you're, becoming a parent for the first time. So we were kind of going through all those emotions.
My husband Josh and I were beyond thrilled. Then, on a sunny August day, after I had just finished the invite list for the baby shower my sister was planning for me, everything changed.
The only way I could describe it at the time was that my body felt like it was open, like I felt wider than normal. And so I called my doctor and told her about the discharge and that weird feeling. And she said, come in right away, which was really alarming because I had had things that gave me anxiety previously. And they were like, no, you're fine. That's normal. And so this was a little concerning that she wanted me to come in, and she got me in like very first appointment. And then, I mean, we were only there for a couple minutes before, just after visual confirmation, visual examination, that I had cervical insufficiency.
It was clear that this was not a question of if we would lose our baby, it was a question of when. I asked what could be done to ensure the respectful passing of our baby and to protect me now that my body was unprotected and vulnerable. I needed an abortion. My healthcare team was anguished as they explained there was nothing they could do because of Texas's anti-abortion laws, the latest of which had taken effect 2 days after my water broke. It meant that even though we would, with complete certainty, lose Willow, my doctors didn't feel safe enough to intervene as long as her heart was beating or until I was sick enough for the ethics board at the hospital to consider my life at risk.
That was a really scary moment, and like looking back on it, if I had to go into work later that day, you know, if all I did was drop Amanda off at the house and I had to go into work or go do something else, I mean, she was in no capacity to understand what was going on.
I didn't have the strength to unlock my iPad. Like, I couldn't have called someone for help, I don't think.
Yeah.
I shouldn't have had to wait in anguish for days for the inescapable ill fate that awaited. But this was August 2022 in the state of Texas, where abortion is illegal unless the pregnant person is facing a life-threatening physical condition aggravated by, caused by, or arising from a pregnancy. People have asked why we didn't travel to a state where the laws aren't so restrictive. But we live in the middle of Texas, and the nearest sanctuary state is at least an 8-hour drive. Developing sepsis, a condition that can kill in under an hour, in a car in the middle of the West Texas desert or on an airplane, is a death sentence.
While I was in the labor and delivery room, in between bouts of septic shock, I was laying in the bed looking at the TV, and it was turned to the local news channel. And I don't think I could change the channel on that TV. It was stuck on this one channel, and they were just covering the laws that had just gone into effect a few days prior. And it was just so infuriating. It was like a slap in the face, because it's like, I'm here with sepsis because of this law that, you know, was passed, what, less than a week ago? I mean,
a few days at that point.
It was just so infuriating.
I may have been one of the first who was affected by the overturning of Roe in Texas, but I'm certainly not the last. More people have been and will continue to be harmed until we do something about it.
I mean, it was just despair, you know, because I knew I was going to meet her, and that just wasn't how I was expecting to meet her.
Yeah, that was a tough day. We're really lucky to still have Amanda with us, for sure. So.
If I had one single message to the general public, it would be realize that the pregnancies we're talking about in this lawsuit are all wanted pregnancies, very wanted pregnancies, that then were complicated by a condition in the mother or in the fetus, where abortion became the best response to it. And I'm sure there are many of the women involved in the lawsuit who never thought they would ever have an abortion or be wanting an abortion. And yet, when faced with the reality of a medical complication, realized, oh my gosh, that's what I need to save my life.
So abortion access in North Dakota pre-Dobbs was already very restricted. So some of the restrictions that existed were they had a ban on D&E procedures. So effectively, anybody needing a termination after 15 to 16 weeks, unless it was for medical reasons, could not get that care within the state.
Anybody want to sign the petition to legalize abortion in Ohio?
Hands off my body. Yeah, let me sign that.
What county are you registered in, miss?
Franklin.
Here you go. And you know about the special election in August?
Yes.
Please tell your friends.
The grassroots efforts of Ohioans who were like, absolutely not in our state. We will protect reproductive rights for women has been amazing. And that actually, like, as much as I'm angered by the Dobbs decision, that actually gives me hope to see people coming out, to see people talking about it. And it's not just Democrats. There are a lot of moderates, independents, and moderate Republicans who are like, no, this is not what I wanted in Ohio. This is not how we thought this was going to work.
We had met with these lawmakers, we had discussed our concerns with them, and you can even see in the public testimony how we testified about, you know, the life-limiting health conditions and how all of these laws cause confusion. You know, also like the rape and incest exception at 6 weeks, that's not realistic. We testified and asked them to broaden their exceptions, and they declined it.
So the American College of OBGYN last year went to the American Medical Association, and 75 large national societies signed onto a letter that reproductive rights are essential health care, that no physician should be criminalized. Really, truly, whatever political bent or view on abortion any medical person has, they do not think doctors should be criminalized.
And so based on that, because I think this law is still way too restrictive, it is way too confusing, and it puts doctors and patients and their families in a really, really difficult position. And so that's why I decided to get involved.
I think it's our obligation as physicians to speak out on what we're seeing and the harm that these laws are causing.
We have gone down and told the legislatures this isn't, you know, abortion is part of healthcare, and they have said they don't care, and they're going to continue to do these restrictive laws. And so we're just going to try a different route because we believe in protecting the health care for Ohioans.
Do you need me to hold a beer or something?
Yeah, that works. Perfect.
All right. Here's your pen.
I would encourage them to be willing to, ask for feedback from people who are working in maternal health before making laws like this, just to know what this looks like and how this truly impacts patients.
I think what we need to understand is there is not a one-size-fit-all. We don't have this overriding medical entity that can tell everyone how their approach to family planning, fertility, abortion discussions and care, for whatever reason that it may be needed. No one entity is going to be able to dictate this standard there. I don't come to work every day in fear. And I don't come to work in fear because I practice in Texas. My biggest fear in practicing as an OBGYN is the same today as it was 2 years ago, 5 years ago, and that is doing a disservice to my patient, missing something, not counseling to an extent where then they have a poor outcome, where I see that I could have done better for them. That is my fear.
The fight will never end. Even if we can turn back the tide now, the forces against women, reproductive health, will never go away. And so that vigilance and constant work are necessary.
It's been heavy. It's been weighing. And to do a career, a calling, I'm not going to call it a career, a calling on a day-to-day basis, and to take a lot of things home with me. to have to take this home now with the patient who called me up and said, hey, I've traveled to a different state. I'm hoping everything goes okay. Just wanted you to know. There are days it feels exhausting that, and especially when I look at the faces of those more disproportionately affected by it, and having to miss work, be judged for it, having to lie why they're having to miss work, not having childcare, and then expected to go have something, a medical treatment done and leave the same day and hope for the best. It's disheartening, and this is not how I saw women's health care being transitioned to. But here it is.
That's it for this special edition of Cronkite News. Tune in tomorrow for more from the News21 project, America After Roe. We'll look at how the merger of Catholic and secular healthcare systems can limit access to reproductive care.
And help for women in areas with high maternal mortality. To see more from this News21 project, visit americaafterroe.news21.com. Thanks for joining us.